This is the daily this thing. No need for.
Yes, doctor. Yes, doctor. See, because we are already having good
Having,
interactions, there is no need to waste the time.
uh, and yeah, is it visible? My screen. Hare, Harane. From Bharat. Voice. Chat करा. Yeah, hello. Uh, I think it's visible. I will start talking. Yeah, scope of homeopathy as preventive and as an adjuvant in cancer therapy. This is a workshop format. I have few ideas about scope of homeopathy, especially in prevention of cancer, because of innumerable cases we are getting, which we are not even knowing. So many uh, doctors are preventing cancer. We know that. So I have some protocol, like stepwise protocols. Let us discuss about those things, and let us make it better to adapt for our convenience. So this layout of this workshop will be fundamentals in clinical practice, and my focus is on cancer care. brief know-how of levels of health, because I have found it very, very helpful in my practice. So I want to advocate about levels of health and difficult cases, determining curable or incurable in homeopathic context, essentials of palliative care in homeopathic context, and cases solved uh, with homeopathy and uh, integratively, especially in cancer cases clinically. Why I am stressing clinically? Because palliative care is a very big setup and very lucrative too. And if we homeopaths gain more expertise in palliative care, which is essentially the basic things of homeopathy, basic things of homeopathy, what we are doing every day routine. So there is only the focus will be shifted on words or the narratives they create, what they say, isn't it? Nowadays it's very famous, like they create narratives. Yeah, exactly. Palliative care is a narrative which has been created by modern medicine or whatever to help the patient. Yeah, that is also there, but which is basic for homeopathy. So if we can adapt those narratives to our thing, and we have to emerge as a forefront in palliative care, uh, because it is quite natural to us, and then we have to uh, uh, we should make it a the whole world should know that homeopaths are doing very great service in this sector, because we are most probably we'll be more focusing on cures in homeopathy context, isn't it? We do palliative treatment, but not palliative care. Palliative care is it's an umbrella. Like palliative treatment is what homeopaths do when it is not helping, because everything is individualistic. We are doing it palliative treatments as part of our treatment courses. But when we wrap it up in a palliative care format, it will be very helpful for future generation homeopaths, I guess. Because if you can see, I have been interacting with my seniors and other doctors who are having a very compassion mind. And Chechi, my beloved friend, she's a senior from Kerala IHMA, and she used to tell, so many young girls come to homeopathy. They do homeopathy with having lots of marks, and in that way they gain seats and they study. Most of them are sole breadwinners of their family. You understand? And they are not very rich, and they come to homeopathy, and it should provide them the basics of life, isn't it? When we see uh, homeopathy, sometimes it may not be that helpful in earning, isn't it? We can't deny that fact, because there are so many factors are there, but basically we can't mint money with homeopathy. Now with palliative care as a uh, perspective, as a potential, we can have a comfortable positioning in the healthcare sector. That's what I wish it should happen. And then it should be like uh, we homeopaths can recommend to our students and even our uh, well wishers, or whoever asks for us, who have particularly they have earnings in their mind. See, usually our patients, uh, they are very much inspired by us, and so many patients, daughters, sons, they will get into homeopathy. We have seen that it's very quite often it happens. But when someone like my friend asked recently, my son wants he got government seat. You mind it, GHMC Bangalore, and she asked me. I could tell her so well it's a very good course, but ultimately he went to engineering college because, uh, yeah, you understand what it is. So it will not happen if we get positioned in a very key areas in palliative care. If homeopathy can fit into there, and homeopathy will also be become a very prospective thing in all our students or whatever their minds. So that is my wish or my desire. Yeah. So that's why I will be always talking about palliative care, palliative care. You will be bored maybe something sometimes. And then I have a small protocol wise, like how we can go about cancer cases, that I will share uh, as we go move forward. So, what are the essentials in clinical practice? This is for very beginners. So, very easy to treat cases are upper respiratory tract, seasonal issues, and recent origin asthma. They are all need only single doses of remedies, or they will go away even with whatever medicines knowledge we have. That is usual things. So this is the bread and butter of most of the homeopaths, right? Medium difficulty. This also is very easy to handle for like not my very seasoned practitioners. They also can manage with these things like Arastax for muscle pains and those types of things. So this is medium difficulty. A little effortful or thyroid and hormonal imbalances, and that is also okay. They can manage with little expertise, gaining knowledge from CMEs and all. But difficult cases are autoimmune, advanced pathologies, and psychiatric conditions, and especially cancer. They need expertise, patience. They need lots of uh, vision in treating such cases. Say, we can't do blunders. It is like in the war front. You have to act quick. It should be perfect. You should reach the target. If you miss, it will be very, very disastrous. So many times. We have little time as well sometimes. Those are urgent cases. I'm not talking about emergencies. Emergency, we don't have to handle. We have to send them. Yeah. So these are urgent cases. So cancer comes in the last group. So uh, and how about levels of health? Uh, see, actually, even cancer has been termed as autoimmune in nature, uh, because the inflammation is chronic, and we have by Professor Vital Kos, he has come up with the continuum of acute inflammation into chronic inflammation. So that is a very beautiful theory. You have to read that paper, and you will gain lots of in-depth knowledge. And maybe tomorrow, day after tomorrow, I will speak a word about that also. It is just like when the acute infections or infections uh, are not handled properly, they are suppressed with whatsoever means, like antipyretics or antibiotics or whatever, they continue in the body as chronic inflammation. And chronic inflammation means autoimmunity. That means origin of all the diseases. So it's a very simple thing. It is a timeline of diseases.
Ma'am, I'm sorry to
Yeah.
interrupt you. Can I ask one question here,
Yes.
please? We saw so much of arsenic album 30 being given.
Yeah.
People drank it like water and ate it like food.
Yeah.
At least here it was available at the panwala in the form of those small, small packet.
Yes. Yes.
So, what you just said right now, can we say that we suppress the that was also acute illness only, which some people use as preventive, some use as a suppressant? Can we say that we are maybe going towards more chronic suppressions and autoimmunity because of arsenic album 30 itself?
No, actually, no. I have proof for that, three or four proof for that. I asked this exact question to my mentor, Dr. Vinod Joseph. He is a Vittal Causian, very strong Vittal Causian, I should say. And he said, arsenic album is, uh, it is being used as a widely used, but it has only psychological effect because its action is very, very less. It is not a, it is deep acting, I agree, but that short duration only it is acting. That is one reason. So it is usually, it is only giving the psychological benefit during COVID, I mean. And then mm, Vitalkos, Professor Vitalkos says homeopathy can either help or it does nothing. That is the rule, actually, basic rule. But in few cases, it can enhance the bodily functions. Like it can start that ball rolling. If we see in lac-acid or phosphorus, ma'am also was sharing about one case, no?
Yes.
Padmaja ma'am was telling they gave phosphorus or some high potency and that patient was gone. So this is like it starts the ball rolling. But in
Okay.
arsenism case, that does not happen. So we are not creating any new disease with arsenic amalgam because the
Okay.
type
Okay,
of
ma'am.
medicine is not deep acting and chronic in nature, whatever potency we have selected.
Yes.
And
Okay.
yeah, and arsenic album they have done research about that also. That research paper is available in Kerala. They have done. It's a very beautiful paper. I will search and I will share it. And it has been
Thank you so
beneficial
much, ma'am.
or nothing else in that way. Yeah.
Thank you so much.
So yeah, we can be happy. It does not do anything. Yeah. Uh, 1 sec. 1 second. I have to call my daughter again. Right.
Madam, you are in mute. Please unmute.
Yeah, is it visible? Now I'm. You can hear me, right? Yeah. Okay. Homeopathy is much sought adjuvant alternative therapy in cancer as well as in palliative care. I have proof for that. I will let you know. And to know the prognosis in each case, levels of health can be a very important tool because it involves studying the current pathology. It helps. It also needs the influence of past disease, that is past history, family history, whatever we are talking about, and past treatment history. This is very important. Usually, I don't know whether we have a habit of digging the past treatments so keenly, because that is a very important thing. Like how many of us will be asking about past treatment with steroids? Most of the times patients will not reveal because they don't think that is very essential. So so many times we have to keenly ask for certain things. So past treatment is a very important aspect. And psychological and other circumstantial stressors, hereditary tendencies, or family history. So human health is categorized into four groups. See, levels of health is nothing but Kent's skull observations. It has been Kent's observations, and professor has taken it to next level. He has made it easy for us to understand Kent's observations, and he has categorized health and all into four groups: A, B, C, and D. And he says it can be more, it can be numerous, more and more in that category. But for practical purposes, I have categorized it into A, B, and C, A, B, C, and D, three levels in each group. A in each group, that is 12. So the response of treatment also decreases as we go down the levels, that is from A to D. So explaining the spectrum of response to the same treatment despite similar diagnosis. And in that college, when I was talking about this one, I told the students, see, previous years when even amateur homeopaths were practicing, and even our pioneers were practicing, those times it was different. There is a dictum like if in a case we fail to relieve the patient, and if it is the failure of the doctor, and if it is a success, it is of homeopathy. I have no problem about the second this thing. If it is a success, definitely it is because of homeopathy. But if it is a failure, it may not be only because of the doctor, because there are so many other factors which were not there previous era. Uh, even before 90s, even before 90s, there were not so many contributing factors from the environment. And especially these antibiotics and steroids, these treatments, no, they will make the human system so so what to say, non-reactive rather. They reduces that impact on them. And you give the correct right indicated remedy, you are giving the correct no sode, you are giving the everything is you are doing perfectly. Patient improves a bit and same stagnation, bit a stagnation. So you think, you start doubting about your own credentials. really I have studied homeopathy, or am I doing it right? So many things. But the thing is, it is because of the level of health of the patient. And so many things, so many times it may not be because of our error. It could be because of the level of the health of the patient. And if we know that, that will be very helpful, because we can help the patient in other ways, uh, and we can stop blaming ourselves. So that's why, especially, see, this is the level of health by Vittelkor. I will just briefly tell about that, and I will give case examples and other examples so that you will understand better. So in level 1, high reactivity and strong resistance. This level, our prime minister, yogis, and all those, uh, those, that category, they never get sick, or even they get sick, they will be okay within, by very small things, like just sleeping for a day or something like that. So they are in the level 1A. And mild chronic diseases, long lasting remissions. See, one, you would have seen, you have treated your grandma or grandpa, you give only one remedy and he'll be all right. Okay, for many coming years he'll be all right, even if he needs the same remedy after 10 years. So they are that way. And in level 3, that is third level, they will have sudden high fevers, but they get better mostly on their own or with very mild stimulus. In homeopathy also, you give only one single remedy, and they will be better. If you repeat, that will create adverse reactions, and they will stop taking homeopathy totally. They said, "Ayo, you gave something, no? I was so better first time. You repeated and gone. Everything was so bad. I stopped taking homeopathy also." Those type of, they are not homeopathic patients. You don't need them. Okay, rather they don't need us. Okay, so A levels are very less people. Uh,
Excuse me,
yeah, sorry, yeah.
slide is not changing, ma'am.
Yes. I have kept this slide only.
Okay.
Of health by vital cause, right? Levels 1, 2, 3. That slide changing. It is changing, right? Okay.
No, ma'am, it hasn't changed.
Oh, fine. Oh, now. Oh, yeah. Uh, and level 4, there is reduced resistance and increased reactivity. So they get sick for each and everything, each and every external factors. And level 5, they will have more frequent acute diseases. Like every month they will have fevers, high fevers, 101, 102, that way. And level 6, they will with complications like renal issues, acute renal failures, or something like that. They will have sudden and very drastic diseases, and usually they will have high fevers. But level 7, they will have deep pathologies. It seems to be everything is going fine, but suddenly they will succumb in that way. So level 8, they will have lower resistance and lower reactivity. They can't, uh, their reactivity is very low, even for homeopathic medicines. If you are treating them, they will not show much improvement or a decrease in the symptoms, whatever. They say nothing, no change, ma'am, no change, ma'am, no change, ma'am. In that way, you have to have lots of efforts to bring in the reaction. And there are level 9, there are unclear symptoms and no subfebrile temperature, no fevers at all, but level 9 and below. And level 10, here, eh, below this level 8, 9, 10, this level we will see usually pathological diseases, and even including cancer. But in cancer, even level 1 person can suffer from cancer. That is not the issue. And they are the things where you see single dose cures have been registered, isn't it? Some doctors say they cured cancer with single dose remedy or single medicine and something like that. So they are all A category people or category people who have cancer, whatever it may be, so dramatic, so deep seeming, so many things, but they respond very well to proper homeopathic treatment, and they will be getting cured just like they never had it. So they are all in the upper categories. So it means that it's not that cancer will be gotten by only lower level patients. Anyone can get any disease, but the reactions what they give, that is determining the levels of health. And in 10, 11, and 12, very difficult to treat, and they are the ones in the palliative treatment sector, and we have to be careful while treating lower level patients, and that is what I am talking about today. And I think you are seeing the next slide, isn't it? Hope you are
No, ma'am, slides are not moving.
not moving. This one?
Yes, ma'am. In fourth slide is there, ma'am.
Oh, okay.
Background, that slide is there, ma'am.
Oh, okay. Yeah, 1 second. Shri? Ah, now I think it's moving.
Yes,
Yes,
ma'am.
ma'am. The
Ah.
seventh slide, ma'am.
Yes, yes, yes. Yeah, I'm feeling very stuck up today because of my shortcomings. Yeah. Levels of health determinant pointers. This is past history of infectious diseases, especially fevers. How many fevers your patient has got, that good he is. His levels of health is that high. So if you had lots of infectious diseases, so you'll be very happy, very happy. And fevers, high or low grade fevers. High grade fevers, very good. Low grade fevers, not good. And treatment course in number of days if hospitalized. Prescription drugs usage related to acute disease, minor illness, or disorders. Usage of CAM medical system, that is very important. I will talk to them about them later. And exposure to chemicals, occupational hazards. This actually even Padmaja ma'am was talking about that. That's a very important aspect. And number of years exposed, type of chemical, and anything intake of chemicals. And uh, I came to know that there are many patients in Tirupur who are suffering from cancer, and it is a textile hub of India rather. You understand, no? Maybe dye could be one reason for that. Uh, and family history, immune compromised disorders like allergies. That is a little minor side. Yeah. But definitely there is immune system involvement. Congenital disorders, genetic disorders, tubercular and other system disorders, carcinomas with age of its development, that is very important, endocrinal abnormalities, and skin disorders. So these are all pointers towards the levels of health. Pointers. Uh, Patient health group classification. Comprehensive assessment of what the pathology means in the specific individual. So in this particular person, what this pathology means. That is very important. And disease prognosis in that specific individual with respect to possibility of resolution of pathology. So whether pathology will resolve itself or not, that is based on the specific individual reaction, isn't it? And treatment approach and expectation will be based on that understanding. And understanding response to treatment or follow-ups, especially with one or two follow-ups only, we can understand that this person belongs to this level of health, because his response to the treatment will be giving us clues. And understanding the posology. So to quote Professor Vittal Kos, Level of health is essentially an individual attribute. Truly incurable cases are virtually non existent. But every experienced homeopath has encountered cases in which the best prescribing procedures with very limited results. Even in such cases, the case is not written off. You don't have to abandon them. But prognostic judgments are made gradually, and determination of curability or otherwise in any given case is highly individualistic matter. So this is from Vithalko's, I'm quoting from Vithalko's Science of Homeopathy. So we have to keep this in our mind always, especially when dealing with pathological and cancer cases. So shall I talk about uh, levels of health more, or I shall move to cases? I think this basic essential will be helpful for understanding why I chose potencies and whatever. What will be your
Madam, cases, madam.
cases? Yeah, fine. Yeah, I will move to the cases then. Yeah, this one a small exercise. Will you be interested? This will be very important for youngsters, but seniors can also guess. Uh, yeah, please suspect the type of cancer on the symptoms. There is a lump in the breast, nipple is retracted, discharge from nipple usually purulent or bloody. This is, uh, guess the type of cancer. Yeah, can someone
That
unmute?
is malignancy, no?
Yeah,
Serous carcinoma.
breast cancer. Yeah, black tarry stools usually first symptom of
Liver cancer.
Rectal cancer. Right?
it. No, not rectal, not liver. Usually
Which is high
colon.
up. High up, yes.
Yeah, high up. Rectal means frank blood. Can
Yeah,
take
what
salt.
is that? Black tarry stools cancer क्या है, madam?
Colon cancer. Colon
Colon.
cancer.
Okay, okay,
Yeah,
okay, okay.
can take uh, solids but cannot swallow liquids.
Esophagus upper.
Yeah, esophageal cancers usually. Single thyroid nodule.
Nodular thyroid cancer.
Yeah, thyroid cancer usually. Persistent cough for months and or blood is put up with low grade fever.
Lung cancer. Huh?
Yeah, lung cancer, but it could be in other cancers as well. Harshness of voice.
Laryngeal cancer.
Yeah,
Larynx.
laryngeal or pharyngeal. Yeah, laryngeal usually. Long standing gastric trouble, severe pain abdomen after eating, not relieved from regular medicines.
Stomach cancer.
Yeah,
Gastric.
yeah. Pain in left or right hypogastric pelvic area in women, labor like pains.
Ovarian cancer.
Yes, exactly.
So, ma'am,
Ovarian.
basically, you are telling all these rubrics from our repertories which can be used for cancer cases.
Exactly, we can use that. But
Yes.
I am basing this as see the initial symptoms where we can think of cancer. This is for final year students, no? That's why I had
Yes.
to keep them engaged. I had made this.
Yes, ma'am. Yes.
But most of things we don't have to. Yeah, postmenopausal bleeding, you understand, right?
Yes.
Oral
Cervical
rash. Yeah. Fever for months, low grade or high fever. And this one,
Hodgkin's.
yeah, lymphomas. And moderate and mild continuous backache.
Bone TB or bone.
Yes, yes. It is usually metastasis, usually. Mets. Yeah. And Mets will be first in the back. Uh, so when there is a cancer patient and he has back pain, we have to first and foremost think about Mets.
Ma'am, that back metastasis is common in prostate cancer, right?
Prostate cancer also common, but all the cancers usually metastasis, usually patients come with backache.
Okay.
Yeah,
Lower back or okay.
lower back,
Okay.
and mild to moderate head heaviness, dull headache or severe headache,
Does this
blindness.
point to cranial metastasis?
Yes, yeah, that is.
Okay.
Total loss of appetite, nausea, excessive tiredness, unusual bowel movements. Any problem persists for months or years without changing. This is that is the
Liver.
yeah, liver cancer and basic of all the cancers. So this is the way it starts.
Ma'am, but when the liver gets involved, then the case processes in a galloping rhythm, right? Unless we do,
Yes,
because liver metastases are the worst.
very less and very rare. Like that is usually kidney, liver will be affected very later. Thing. Yeah. Weight
Okay.
loss is not an initial symptom; it is a later symptom. So weight loss is not. But if there is unexplained weight loss, you have to think of cancer too. But that is a little advanced. Yeah. Uh, Palliative care, I will not be talking now. Yeah. Only this slide I will talk. Uh, so in the course of illness, homeopathy can help in all these sectors at this screening level. So screening level, we homeopaths can detect cancers with symptoms, isn't it? And diagnosis, we have to send them to advanced cancer care centers itself. That is the best thing. Better not to uh, take chance by sending ourselves to diagnose the cancers. And this curative care we can take care of in early stage cancers or whatever I told, the levels of health, higher levels of health cases. So curative care also we can take care of. And active disease is there that can be palliated or curative with homeopathy. And minimal disease directed, these are all allopathic ways. But we can help in all these sectors. And in the end of life care. End of life care means not just the people who are going to die in one day, week, or in the end of life care means above 65, 75 till they exist. Maybe 10, 20 years also could be end of life. So this is a very, very important sector for homeopathy because we can manage them so beautifully, so beautifully. They'll live like kings for whatever, how many years they will be there. And bereavement also we can help. So in a way, homeopathy is in such a position that it can help in each level of palliative care and each level of patient's needs. So I will go to the cases. Yeah, this is what decides. It is a very important thing is ability to rise a high fever that decides the level of health, and that is very, very, very essential for any patient to rise to during an infection. But in cancer cases, you if you are getting fevers, that is an adverse reaction. You don't expect that. And this is a prevention case. She had a abdomen pain so severe that she will fall on the floor and she'll be breathing in pain. And this had happened already 2 or 3 times. This time it was very severe, and she came. She asked me to relieve her immediately. So based on her symptoms, that was she was better by uh, hard pressure and warmth and aggravation by slightest of a movement. So I gave her Bryonia 30, and she was fine. Okay, she improved. And then next day she went to doctor and she was hospitalized. Uh, and then mm there also in the hospital also a painkiller was given, and her pain started again. It increased.
Ma'am,
So
only 30 potency in such a severe pain?
no, no. yeah, that's what I was not knowing what level of health she belongs to, because if she is my old patient, I will know what to do, what potency suits her. But in this case, since it is a urgent case, or it is almost emergency type, so I chose a lesser potency. So it is better to go by 6 or 30. 6 I usually use, very very successful, because I can repeat the medicine so often, every half an hour or 1 hour once, divided doses. That way it cures, even especially during COVID. I used to give them every half an hour to 1 hour once, when the symptoms were very severe. And here also bryonia was given in a divided dose every half an hour to 1 hour, and she
Okay.
was relieved. And then
Okay.
vomiting started after painkiller injection, so then I started with ipecac 6, and she was relieved. And she was given mac first 200. 200 usually works wonders. Mac first 6x also is very helpful, but 200 especially, it gives immediate relief. That's why I chose her, chose mac first. And she her CA 125 was positive. Mm, and then after but she didn't do the second uh, testing. I asked her to do again, but she's not interested to do the testing again. Uh, CA 125 was positive. Oh, it was. I couldn't see this. Yeah, reports I have
Ovarian
attached.
cancer.
Yeah, it was positive, and it was 123 or something like that in the first time. And but second time she didn't do. But she is staying free of cancer now almost yeah, 5 years now. And case scenario 2, this uh, yeah, foul smelling discharge from PV. She a gynecologist too, and it was postmenopausal bleeding with CIN 3. CIN is cervical squamous interepithelial neoplasia. So CIN 3 is actually, it is not cancer as such, but it may lead to cancer. So this was post vaccination. This patient I had treated for her allergy before. I asked her not to get vaccinated, and she didn't get vaccinated. But she was to go to US to see her son, and she got vaccinated. And after that few months, she got this foul swelling discharge from PV, and she was very scared. And I told her this can be handled with homeopathy, but they didn't have that and that courage. So she went for hysterectomy, and it was seen that it had carcinoma in situ of cervix, and she is doing well till now. She is in touch, and she is doing well. No other things. And she had some problem with her piles problem, and that also she took treatment. So actually, this is the opportunity lost. We could have treated her with homeopathy itself, but they didn't have that courage. And um, this is a one case of 69-year-old lady who had during COVID, and she had CT score was 14/25, and the corads were 5. She had a very severe breathing issue, and oxygen was not available at that point of time, because of you all know, no, there was a lack of oxygen supply, and she was in very much distress. So uh, it was a severe cough as well, and her diabetes is she's on insulin, and I gave her Carbovage, and I sent the medicines immediately. Carbovage 6C immediately helped her to relieve her respiratory distress. So, and then after Carbovage, Bryonia 200 was given for her body pains, fever, and she can't move much. Like that is for her COVID. And then Next day, her oxygen cylinder arrived, and she managed to turn it on, and SpO2 was 92. So it was 87, 85 to 87. It will dip to even less, and it was 96 after homeopathy was added. And then they stopped homeopathy after this. Okay, she got better, and they stopped homeopathy. And then again she contact her daughter-in-law contacted me in April 21. No, and she had loose motion, and she was having craving for juices. This symptom was still present. This was in the first time also. Now also it was present. And again I started with acid for 6C, but it didn't help her much. Her sugar levels were very high, and then again they didn't continue. They stopped the medication, saying that she went back to Kerala. And after that, after around uh, 5 6 months, her daughter-in-law again contacted me, and she said she had breathing problem again. Now she had even dysphagia. She has pain in the ribs as well. That is post-COVID effect. And then uh, this time she got all the tests for her. All the tests were done, and she was suffering with multiple myeloma with metastasis. Primarily, site was undiscovered. See, here it was a very clear symptom of acid force. She was craving for juice, even though she had breathing issue, and this was previously also present, but it didn't relieve. I was thinking I am not given the proper treatment, but that's why she is not responding. The real thing is that cancer was there underneath, which was not detected till then, and that is the reason why our prescription, well selected prescription, was not helping her. And now after uh, this I started again I started treatment for her uh, till she was better with the carbohydrates for her breathing issue, because she has meds whole body, or like all over meds, including lungs. So, and she had a very deep breathing deep and in distress, and bowel movements are very painful, and dry hard stools. So still she looked like bryonia. So I started with in uh, Jan 22. I started with carbohydrates for her, and at night her breathing was eased. She was less stressed, and on ninth early morning she breathed her lost. She was alert till the end. So, uh, see, in this case, it is not about the cancer. Uh, Maybe if she had continued homeopathic treatment in 2020 itself, and everything was needed was done, maybe we could have prevented her. But this is clearly, it shows that she was in a lower level of health, maybe uh, in the D, group D, and her cancer was progressive underneath. And in such cases, well selected remedies are not helping, and also we need to go for palliative treatments and palliative care, other modes as well. So this is one learning, that follow-ups are very important, especially for this type of cancer cases. Follow-up preferable with the same, because she was shifting from Kerala and Chennai, and she was changing the homeopath as well. So and she was telling that how much she was helped with homeopathy in the last moments, especially. See, um, homeopathy, we are helping our patients with homeopathy. Sometimes we will feel, in cancer cases and autism cases, these are all very difficult to treat cases. So why bother? Why we have to do all those so much of in depth? Even emotionally, we are also drained. We have to work so hard for these cases. But when we see the words of those kith and kin, no, then we will understand how great help homeopathy is doing for those patients, especially in end of life care. So I think we have to provide that support, especially to the patients in their lost lost stage. So what do you think? You please let me know. And another case, 69 years. Yeah, one second. Uh-huh. Yeah, this is a very interesting case. It is one of very early cases of mine. Uh, like in 17 to 2017, 16, 17, I started treating her. She is still with me. Like I know about her through her daughter. And then she was 69 years. And she had constant burning in abdomen relieved by drinking sips of water or juices. Cares and worries about her husband's health. He had a cardiac arrest recently, and he's a very pestering type of person. Like he is totally dependent on the patient, and she was caring for him since he had a heart attack. So she felt excessive tiredness and concern about her health, and also she was very strict in her diet. She was taking care of her health self very well, and she used to talk a lot. She had knee pain, and she was losing weight at normal routine. Appetite was total nil. She didn't feel like eating. She was feeling averse to cooking food, and she her sleep was also disturbed. Her motions were occasionally tarry stools, and usually constipated, but sometimes low stools as well. And perspiration was moderate, and her past history, you just see, she had gestational jaundice in 1990, asthma till 1993, fibroid hysterectomy in 2004, typhoid and malaria in 2005, cyst in her liver, and this is her past history. So many uh, diseases. Can you guess her level of health? And she had typhoid and malaria, high fevers in 2005. So, what do you think? What could be her level of health? If you can guess.
It is very good, madam. She will be reacting well.
Yeah, probably she is in level of health in uh, that cancer was in I guess it is in the little lower level, maybe 8 9 in that level. But she was healthy. She had repeated problems, gestational jaundice, and typhoid, malaria, very high fevers she had. So her level of health was decreasing. Acute stress of her husband's uh, caring for her husband, and probably that pushed her to the cancer. And then after treatment, she rose back to her uh, original this thing. And you know what, she was totally okay with uh, Talimur and colchicum. Colchicum was repeated like frenzy. Whole day she will be drinking colchicum 30 with half gram of half 100 ml, like 1 liter bottle. Whole day she will be drinking colchicum 30. And then Kalimur also helped her a lot. And then she was totally all right for almost 17 to 18 years. After resection of her polyp only, she came to me. She don't know that she has cancer in situ. Her children didn't tell. And after that, she had and then she had COVID fever continuously for one whole day. She got COVID fever from her grandson. She was the second person to get COVID fever in her family of 11. And then from her, everyone else got. And at some point of time, she was taking care of all her family members because everyone was down with COVID fever. And uh, got, she was back to herself within 1 day, like a 104 fever, and next day morning she was almost okay. And within 2 days, she was back on her back on her legs. Like she was working in her house. She was cooking something like that. So you can understand her level of health is very high, isn't it? So this is one way, like, and she always needs the same remedy. Even now, symptoms come back. I will prescribe usually Colchicum 30 and Calimer 60, and no more problems. So this type of cases, no, very good, right? We'll be very happy about that. Yeah. Uh, this is a little long case. So shall I continue, or how is it? It is 10:15.
Madam, we will continue tomorrow, madam. But please
Yeah.
summarize the points today what you have discussed about
Yes. Yes.
and
I will do that.
what
Yeah.
is the takeaway points today.
Yes. Yeah. This. No, this is my. Uh, yeah. Today I was talking about basically about levels of health and how it helps in determining the uh, patient's um, level of health and treatment course, what we can achieve. So what we can plan for. So hereditary load, family history, that is very essential. I don't have to talk about much about that. Ability to rise a high fever during infections. During infections, that is important, not otherwise. And vast medical history and clarity of symptoms. These are all very important. Clarity of symptoms. So if patients are getting with very clear symptoms, that means they are in the higher level of health, and they are repeatedly in the same symptom, same remedy, uh, same way, same symptoms. They are coming up again and again. So we are probably very in a very good treatment. They will respond very well. Oh, sorry.
Madam, high grade of fever during infection, what does it infer?
Yeah, like fever should come for infections, means viral or bacterial, like seasonal flu and other things. So when there is dengue, chikungunya, malaria, typhoid, they are having higher levels of fighting spirit. If they are getting fevers for heated high temperatures, like uh, summer stroke and all, no, that is still okay, but not it is not infectious in origin, right? So summer stroke is not a that does not mean they are in a little higher level of health. So when our body identifies there is some invader, that is very good. If patients are getting fever, high fever because of cancer, especially in leukemias, they will have high fevers. That is not in infections origin. So that is a bad prognosis. And even in usually in uh, just before dying, patient will have very high fever. So many cases, 102, 103. And if you see patients without reason having high fever, that could be one lost effort to make the sort out the things, which may fail. And so in a way, what today I told basically is about level of health, helping us to know the no, actually I want to talk about something. Okay, I will.
यस मैडम, आखिर कहना क्या चाहते हैं आप?
Yes, yeah, I will. That's what I'm searching the my slide actually. Not this one. Mm,
Yes, Dr. Sneha, you can unmute and ask him.
yeah, yeah. This I will talk about this. Yeah, if you have any questions, you please tell me. Uh, Otherwise, I will summarize.
Yes, Dr. Sneha, do you have any question? You have raised your hand now. Please continue, madam.
Yeah, yeah. Uh, See, today my point was how homeopathy can be very helpful in palliate, not just palliative treatment, but in as a part of palliative care for patients, especially in the uh, cancer group where it is a very difficult case to treat, especially advanced cases and in pathological cases. And we for that we have a very good tool, that is levels of health, proposed by Professor Vittal Kos, which will help us to know the prognosis, know the potency selection, know what can be done next in the those cases, and we can understand uh, what could be the uh, outcome if we give this potency or this treatment, and we can recommend what can be done next for those patients. For that we can even warn the usually in my cases I will warn the relatives. Say 93-year-old, 94-year-old, we start treating them for minor complaints like cough or breathlessness, whatever. We have to tell them that they are of very good health, but if we treat with homeopathy, we can roll the ball, and that can be their end stage as well, because that is very essential. If you are not willing to do that, don't take homeopathy. I have told so many cases likewise. So that we should be clear what we are doing. Clarity should be there in our mind what we are doing with this case and what is the outcome of the treatment given by us. And so levels of health is a very essential tool, and you have to study it. That is the takeaway point for today. And I can talk about what potencies is suitable for which level of health maybe tomorrow, because I think time is up, or I should complete that as well today. If any,
Madam,
no
tomorrow,
question,
madam. Tomorrow
yeah,
only. And
yeah,
because it is 10:23, we'll just, I just wanted to ask you, madam, like
yeah.
your bryonia case, your phosphorus
Mm.
acid phos case, so and the other case which you have explained, all those are relieved completely, right? And they are reacted very well to those
Your
drugs in the beginning only, right?
voice is broken.
Mm. No,
Yeah.
those cases, no, they have reacted. No, madam, I have received a blow. I just fall down on the road while getting to auto, so my teeth has broke, so I am not able to speak well. That is a problem.
Oh,
Just now, 15 minutes back, so I'm keeping some
okay.
iceberg and I'm speaking to you. So,
Okay.
what I want to ask is the cases of bryonia, acid, phos, or Corbovage, what you have explained,
Hmm.
uh, they are they reacted well to the in the initial stages only with very few medicines. That is what you want to explain, right, madam? Did I
Yeah,
get
that is one
correctly?
thing.
Uh,
Yeah,
uh,
this see first case, whichever I had told you, this is abdomen pain, severe abdomen pain. This is a twisted ovarian cyst. Okay, and she had twisted ovarian cyst is the first stage of cancer, and her CA 125 was also positive. Since her level of health is very high, she was treated with homeopathy, and she could prevent progress of cancer. Okay, and within few doses of bryonia she got better. And here symptom picture is very clear, you can understand. And since her level of health is very good, she prevents malignancy for now 5 years. Okay, and she didn't get the same symptom again. So this is one point. And in case 2, this is foul smelling discharge. Here that levels of health is little lesser because she has no fever. She reacted directly with cancer for COVID injection. See, if you have even COVID, everyone didn't have the same symptoms. So few people had direct heart attack. Few people had direct lung infection. Few people who had very high levels of immunity, they died. So it depends on each individual reaction. Here you can see, even though she didn't have many complaints past and family history and whatever, and even she was on homeopathy, she reacted to vaccination with cancer. So her level of health is less. So I will choose her lower potencies, and then I will move forward for her treatment. So uh, this is the way we will move forward. And in this case, since there was no follow up, proper follow up, maybe initially we had the clear symptoms, isn't it? She was craving for juice and all those things. It was clear symptoms, but only symptomatic treatment didn't relieve her. Even though symptoms were reduced, that disease was progressive underneath. So they came to know about our cancer much later. Okay, but if we had known, or if she had continued with homeopathy, okay, with the same this thing, maybe she could have prevented such a massive metastasis. Maybe. That is one thing. So here also the level of health is very less. And then uh, which case? Yeah. So
yes, madam. Got it. Got it.
this is the way. uh, Actually you raised the correct question, ma'am. That's why I could summarize the whole thing what I am going to tell. I think it is clear by now. So we prevent in higher levels of patients, we can prevent. And if the lower levels of patients are coming, we can have best outcomes. Best outcomes. And if in very lower levels of health, we can just give them certain amount of relief, just like in the last case whatever I was talking about. So I think this is the takeaway from today's uh, daily learning. Tomorrow, what you will be wanting to discuss, please let me know. I will prepare accordingly. Palliative care, I want to talk about that, but if all are interested, I will be talking about that because it's a little somber, gloomy thing. Yeah,
Madam, you can discuss these topics tomorrow. Like,
yeah.
how would we advise our patients
Hmm.
because of their anxiety? What
Hmm.
they say that हमारे फैमिली में 2 कैंसर डेथ हो गए, मेरे मम्मी
Hmm.
के मुझे भी क्या क्या
Hmm.
टेस्ट करना है?
Yes,
So
yes.
when would we advise a patient for
Hmm.
any other particular test
Okay.
in cancers? Huh? So
Okay.
that part will be very helpful for us, madam.
Yes.
So try to please discuss that one. That means
Okay.
if the mother is having ovarian cancer, so the
Hmm.
lady also will be taking about CA-125 testing
Yes.
or
Yes.
CA-123 test for lung cancers like that. So
Yes.
it's not essential, na? So when would we tell them to go for
Yes.
a pro cancer test like that?
Correct. Correct.
So that point and what are the basic tests for different types of cancers?
Yeah. Yeah.
Like
That I will.
CA-125 is there for ovarian cancer,
Yes.
like different parts of the cancer,
Mm.
what we have to go for that. That please discuss that one madam,
Okay.
tomorrow.
So tomorrow I will be talking about protocol, whatever I have said.
Ah,
It is like my reference points.
mm.
I'm not a legend or whatever. These are my reference point. Maybe it will be helpful for you or not. We will discuss about that. Along that, along with that, whatever you are telling, ma'am, I will concentrate on how I have prevented cancer essential it is like it is abstract actually, but we have certain clues that I have prevented the cancer in those cases. We have certain clues. Okay, so I will discuss two such cases tomorrow, and I will let you know what basic tests usually can be employed to know, and what time we can talk about getting tested. Yeah,
Okay,
that
okay,
I
thank
will.
you.
Yeah, from tomorrow I will talk about these things. Yeah, fine. Thank you so much for bearing with me, and hopefully you had certain uh, learnings and maybe confusions too. Please let me know with your questions so that I can uh, clear the clear your